Ulcerative colitis is a chronic, so it means a lifelong condition that causes children and adults to have significant gastrointestinal symptoms. They have vomiting, they can't gain weight, they have poor appetite, and probably the most distressing aspect of the disease is they constantly have to go to the bathroom, they have accidents, they're having to go to the toilet between 12 to 16 times a day, and they pass a lot of blood in their stool as well.
Like, I would usually have huge fits of fatigue, usually before it flares up, and generally my activity level would also be decreased, because when you flare up, you're starting to lose blood too, and it's not helping.
When you're struggling with something like ulcerative colitis, that's something that you're being told you have for the rest of your life. You need to take treatment every day. At the times when you need to be at your best, when you're graduating, when you're going out on your first date, when you've got a big exam, those are the times when your body can flare. And we know that. It reacts during times of stress. So you take a child who is still trying to grow psychologically, but also physically, who has been told that they have a major lifelong illness and that it's completely unpredictable, and at some of the most important times of their life, they may be cooped up in a hospital or sitting on the toilet all day and night. That's what makes this so hard.
I remember when I was first diagnosed with it, nobody knew what I was talking about at all. Not even my friends knew, and even the teachers, like, they didn't know what it was. So it was really hard to adjust my life when I first got it, just because nobody knew what it was.
The province of Ontario, compared to anywhere else in the entire world, has the highest rates of inflammatory bowel disease. And even more specifically, given that this is a pediatric trial, the rates of IBD and ulcerative colitis in children under the age of 10 are the highest in the world in Ontario. So we don't know why these rates are so high. We don't know why they're increasing like this. And it makes us feel that along with that, it's really time to come up with some new treatments. So the PediFETCH trial is a randomized controlled trial that we're doing here at McMaster to look at the role of fecal microbial transplants as a treatment for ulcerative colitis. So fecal transplants, it sounds pretty gross and terrible to people when you try and describe it, but essentially it's the act of taking stool from a healthy donor, so their poop, and putting it back into someone who is sick or has a disease. And in our case, we're trying to see what happens when you take the stool from a healthy donor and put it into children who have ulcerative colitis. This is the very first trial of this kind ever happening in kids, and and in Canada. What was found probably about 15 to 20 years ago was when stool was taken from healthy people and put into patients who kept getting recurrent episodes of C. difficile, miraculously, they had significant improvement and they were cured from this, far better than any medications that had ever been given. So taking that same fact that it worked so well for patients with this infection, we started to wonder if it could make a difference for patients with ulcerative colitis. We feel, based on some of the previous studies, that this has the greatest chance to either work or to give us some clarity on whether this is ever going to be an effective treatment. The alternatives that are currently being given to patients involve drug therapy that costs up to $60,000 to $80,000 per year, is hard, has a number of significant side effects, and is challenging for many, many patients. The fact that this is perceived as something that's more natural is something that a lot of patients seem to hang on to.
For me personally, I wanted to help with it because I wanted to help other people, to help them find other treatments, like better treatments for them, so that they could maybe have better options in the future. So that's why it's important to maybe urge others to also participate in a program like this, so that, you know, there's more data and maybe we could find something better for others.